All right, welcome to our explainer. Today, we're diving deep into the making of a pretty special kind of doctor, the physiatrist. They work in a fascinating field called physical medicine and rehabilitation, which is really built on this one simple but, profound idea. What if a doctor's goal wasn't just to stamp out an illness, but to actually restore a person's ability to live their life to the absolute fullest? I mean, that's the core question that drives this whole field. It's a totally different way of looking at medicine, one that focuses less on the pathology and way more on a person's potential.
So what exactly is physical medicine and rehabilitation, or PMR as it's often called? Well, it's a medical specialty that is laser-focused on restoring functional ability and quality of life. The doctors, who we call physiatrists, help people with a massive range of conditions, everything from a spinal cord injury to a stroke or even a musculoskeletal disorder, to get back as much function and independence as they possibly can.
And that leads us right into the mission of the physiatrist. You can think of them as the architects of function. They're the ones leading the charge, designing the whole blueprint for a patient's journey back to doing the things they love.
And this idea of leadership, it's not just a nice to have. It's absolutely central to the role. Physiatrists don't work in a silo. A huge piece of their training is about creating synergy. Leading a diverse team of professionals where the whole is so much greater than the sum of its parts.
And believe me, this team is extensive. The physiatrist is the conductor of an orchestra that includes physiotherapists focusing on movement, occupational therapists helping with daily life tasks, and even prosthetists who design and fit artificial limbs. It's a truly all-encompassing, holistic way to look at patient care.
Because in the end, it all comes back to the patient's life outside the hospital. The ultimate goal, as the World Health Organization frames it, isn't just about medical recovery. It's about helping people achieve optimal social integration, basically the ability to get back out there and participate fully in their community, and to do it with dignity.
So how do you even build one of these specialists?
Well, it's definitely not a short journey. Let's pull back the curtain and look at the intensive training blueprint that takes a medical graduate and forges them into a physiatrist. We're talking about a dedicated, full-time, 3-year journey. That's after medical school. And this entire intensive program is really built on 3 essential pillars.
So the whole training philosophy breaks down like this. You've got a heavy, equal emphasis on both theoretical knowledge, the what and the why, and the practical skills, the hands-on how-to. But look at that last piece, making up a critical 20%, attitudes. This is all about the professional mindset, the ethics, the empathy, all the stuff that's so incredibly crucial for this kind of work.
And the training progresses in a really logical way. Year 1 is all about laying that foundation in science and learning how to do a proper clinical evaluation. Then in Year 2, they start developing those core clinical skills and, importantly, learn how to manage that big rehabilitation team. By the time they hit Year 3, the focus really shifts to mastering advanced procedures and starting to specialize.
So all that intensive training, it builds an incredible skill set. It equips these doctors with a huge range of tools, a true physiatrist toolbox, all designed for one thing, restoring function.
And when we say the toolbox is vast, we really mean it. This is one of the few specialties where a doctor might be prescribing some therapeutic exercises in one room and then head down the hall to an operating theater to perform surgery. It all just depends on what that specific patient needs to get back to their life. The breadth of skill here is just incredible. On one end of the spectrum, you have the non-invasive stuff, like prescribing specific therapeutic exercises. Then you move into the invasive but non-surgical world, with things like targeted nerve blocks to manage pain. And then, all the way on the other end, physiatrists can actually perform complex surgical interventions, like tendon transfers to restore movement. It's an amazing range.
So with all those tools, how do they decide which one to use? Well, it's not guesswork. It comes down to a super structured, methodical evaluation process. They start by getting a complete history, then do a really detailed physical exam. Only after that do they formulate a specific rehabilitation diagnosis, order the right tests, and finally design a management plan that is built completely around that individual patient and their goals.
Of course, with a skill set this complex, you have to have a really rigorous way to prove that a trainee is ready to practice on their own. The way they're assessed is every bit as comprehensive as the training itself.
They basically use 2 key methods to check for competence, and they test 2 different things, thinking and doing. The case-based discussion, or CBD, is all about the thinking. An expert sits down with the trainee to talk through a real case, digging into their clinical reasoning. On the flip side, directly observed procedural skills, or DOPS, is all about the doing. An expert literally watches the trainee perform a hands-on procedure to make sure their technical skills are up to snuff.
And it all leads up to the final boss, the board examination. And these exams are no joke. There's a massive theory component, we're talking 4 different papers, but there's also a really heavily weighted practical exam that tests their skills on actual patients, and even includes an oral defense. You have to pass both to get certified.
But you know, a physiatrist's job doesn't just stop when the patient leaves the clinic. And this brings us to a final, and honestly a crucial point about the philosophy that's really at the heart of this specialty. This quote, right from their own training curriculum, it just gets to the very soul of this specialty. It defines the physiatrist not just as a doctor, but as a dedicated advocate, someone whose actual responsibility is to help their patients fight for their right to live a life with independence and dignity.
So what does that actually look like? It means their job extends out into the community. A physiatrist will fight to make sure their patient can get back to work or school, that they have safe, accessible housing and transportation, that they can navigate all those societal barriers that can get in the way of really living. It's about total patient care.
And that really leaves us with a final thought, doesn't it? The physiatrist has a professional duty to be an advocate for their patients, but it's also such a powerful example for all of us. It really makes you ask the question, how can we, in our own lives, become better advocates for a world where everyone, no matter their ability, can participate with dignity?